Responsible use of antibiotics. What are antimicrobial antibiotics? Infectious diseases caused by bacteria, viruses, fungi, parasites, and prions are causing a great concern in our society, given their widespread and possibility to simultaneously infect great numbers of people. Despite the development of new antibiotics and vaccines, infectious diseases are still the third most common cause of morbidity, even in developed countries of Europe and North America. Antibiotics, used to treat bacterial infections through inhibition of bacterial growth or outright destruction of bacteria, are called antimicrobial antibiotics. More accurately, antibiotics refer to drugs developed from natural sources such as other fungi, bacteria, or lichen, while synthetically developed antibacterials can also be called chemotherapeutics. Antibiotics are divided into classes and generations according to their chemical structure, mechanism of action, and the sort of bacteria that they work on. The effects of antibiotics can be bactericidal, leading into bacterial death, or it can be bacteriostatic, meaning halting bacterial reproduction and growth. Different antibiotics disturb various processes in bacteria. Penicillins, for example, belong to the group of antimicrobial antibiotics that inhibit the synthesis of the bacterial cell wall. Fluoroquinolones, for example, inhibit the synthesis of DNA required for bacterial reproduction. Trimethoprim, for example, disrupts the bacterial ability to make folic acid, which is vital for its growth and development. Antibiotics can also have multiple mechanisms, which can mean greater efficiency or broader coverage of multiple bacterial species. Thus, antibiotics can also be divided into narrow-spectrum and broad-spectrum antibiotics. To properly determine the dose and frequency of taking the antibiotic, we must know the pharmacodynamics and pharmacokinetics of each drug. Main pharmacokinetic parameters are Cp max, determining the highest concentration of the drug in plasma. MIC is minimal inhibitory concentration of the drug. T greater than mic is the time, during which the concentration of the drug in plasma is above the minimal inhibitory concentration, MIC. Area under the curve, or AUC, is the area determined by the curve of plasma concentration over time, and can be measured in vitro. Certain antibiotics, like beta-lactams, linezolid, clindamycin, erythromycin, and clarithromycin, are efficient over time, for as long as the plasma concentration is above of the minimal inhibitory concentration. Therefore, dosing of such antibiotics can be smaller, yet more frequent doses. Other antibiotics, like fluoroquinolones, aminoglycosides, metronidazole, and daptomycin, are more dependent on the highest serum or tissue concentration, Cp max MIC. Therefore, they can be given less often, but in higher doses. Third group of antibiotics can be defined by the area under the curve, and are called mixed-type antibiotics. Such antibiotics are fluoroquinolones, tetracyclines, glycopeptides, and some aminoglycosides. Humanity is facing a huge public health crisis due to emergent bacterial resistance, as some former antibiotic workhorses are increasingly losing their ability to cure infection, with no new antibiotics in sight.